Carly, thanks. Well, cold and flu season is upon us, and managing the health of you and your family can be very stressful this time of year.
So KCU Assistant Professor of Primary Care, Dr. Benjamin Grin, is joining us this morning with some helpful tips for parents and educators. So to start with, Dr. Grin, what are the key differences in the symptoms between COVID and the flu, and when should you seek professional help?
Great question. Thanks for having me on the show today. So, COVID and flu are both respiratory illnesses caused by viruses. COVID occurs year-round, whereas flu is more of a seasonal condition. It is very hard to distinguish the two conditions. Both can present with symptoms like fevers, cough, muscle aches, body aches, congestion. If you're concerned that you have COVID or flu, I'd recommend doing an at-home test and call your doctor if it's positive. There are medications that can help reduce your risk of getting seriously ill from either of them. And if you have more serious symptoms like high fevers or shortness of breath, you should definitely seek medical attention.
And who should consider getting the COVID and flu vaccinations this season?
So here are the recommendations from the CDC. So the CDC recommends that all people who are 6 months of age and older should consider getting a flu vaccine. And the flu vaccine is updated every year to better reflect the strains that we think are going to be circulating this respiratory virus season. As far as the COVID vaccine, their recommendation is that this should be a shared decision between patients and providers. When patients ask me about the COVID vaccine, I recommend that pretty much everyone get it. I have a very low threshold to get vaccinated. And if you have a chronic condition like diabetes or hypertension or some immune compromising condition, I even more strongly recommend vaccination.
And of course, this is that time of year, Dr. Grin, when families send their little ones off to school, and before you know it, half the class is coming down with all the same thing. Are there any things families can do to sort of mitigate that?
So vaccination is probably the most important one, just because that's going to prevent folks from getting really sick or hospitalized from these illnesses. The other things are pretty common sense. So wash your hands, maintain good hand hygiene. If you're sick, stay home from school or work, and you don't want to go back until you've been fever-free for 24 hours and you're starting to feel better. And wearing masks, especially in crowded indoor settings, can be helpful.
And what trends are we seeing so far this cold and flu season? I've heard things as much as, the flu's coming earlier. I don't know if this is all just hearsay. What are you seeing?
Because of the government shutdown, we're pretty limited right now in terms of national level data, but the data that we have so far shows that flu levels are overall relatively low, but it's going to creep up soon. This is a seasonal illness that we see most December through February, and that's why we recommend getting vaccinated early so you have that protection before. COVID levels are moderate, but it could go up at that time when people are spending more time indoors and in close quarters.
Yeah, if the warm fall has done anything, maybe it's delay a little bit of the illness from hitting too early. We've been outside all the time.
I hadn't thought of that, but that makes sense.
That would be nice. Hopefully that rings true.
Yeah.
So, Dr. Grin, thank you so much
You're
for
helping the doctor,
us.
Abby.
I don't know. But listen, my whole life revolves around who's sick in my house. So that's just the life of a parent, I think.
Yes.
Yeah.
It's the life we chose.
It is. It is.
Good stuff, Dr. Grin.
Thank you so
again.
much.
Thanks so much for having me.
Absolutely.